Hello. So I don't know what happened. I think we got
I
disconnected.
don't know what I don't know what just happened. I'm sorry, I don't know what just happened, but let's just start again. Let's see. I think everybody that was on is coming back on. Okay, sorry guys. I don't know what happened. I don't know why we got disconnected. I'll give a little prelude here and then we can pick back up where you were before.
Okay.
So everyone, welcome to the Village Doctors. Welcome to our page. Um, we have the illustrious Dr. Pham here from Level Up Nursing. So she was introducing herself, telling us a little bit about herself and who she is and why she got into nursing. So you can go ahead and pick up where you left off.
Okay. Sorry about that for any interruptions. I don't know what technical difficulties we were having, but we're back on and live. So I was saying I'm Fameisha Williams. I go by Pham or Dr. Pham. I'm a nurse practitioner. I'm an adjunct nursing faculty, which I'm taking a break this summer, but I'll be back in the fall. Um, I'm a mom. I'm a nursing mentor. So I have my business Level Up Nursing. That's the platform that we're on now. And I got into nursing because I want to get into a field that I could give back to people, which you're definitely always giving of yourself in nursing. But then I just realized there's so many other things you could do in nursing. You can become a nurse. I started as a CNA, then I became a nurse, and then I wanted more autonomy, so I went back to nurse practitioner school and got my doctorate. I'm certified as a family and acute care nurse practitioner, and currently working full time as a cardiothoracic surgery nurse practitioner currently. And that's kind of
Impressive.
where we are right now. And then my mentoring business.
That's so awesome. So for those of you that weren't on before we got cut off before, I was telling her that she's so awesome and, just bragging on her and just basking in her glory. I mean, you do so much. And she was saying that she didn't think she did that much, but then she just came and told us all of these things that she does. So you do a lot and we are in awe of you. We appreciate having you on our page. We appreciate
Thank
you
you.
agreeing to do this interview with us. We're super excited. Um,
Awesome.
I think it's so awesome for myself. I relate to your story in terms of I started as a CNA,
Mhm.
and I, went through, got my BSN, and now I'm working on getting my DMP. So,
Awesome.
yeah.
Congratulations.
So, like I said, you're doing everything right now that I want to do in my future. So,
No,
that's
and
cool.
you're gonna get there. Just keep pushing forward. You're gonna get there.
Thank you. Thank you. Thank you. Okay, so everyone that's viewing, everyone in the chat, feel free to toss in any questions in the chat as you think of them or as they come, but I'll go ahead and get started with some of the questions that I have for you, okay?
Okay, sounds good.
All right, awesome. So can you describe your transition into becoming a DMP? I know DMP students like myself that come from having a BSN or from being a floor nurse, we struggle to move to that DMP provider role, with that transition. Can you talk about your transition into becoming a DMP?
So I know a lot of programs now are starting with the BSN to DNP. I didn't
Mhm.
go that route. I went from the BSN to having a master's, and then years later, I went back and got a doctorate.
Got you.
So the DNP itself is just more of the research side of the clinical side of being a nurse practitioner. So for those who don't know, you don't have to have a doctorate, but that's the way they're moving towards of making it required. It's not required currently in all states, but they're moving that way. But so when I got my master's, transitioning from the RN to NP role, I think that was the hardest transition for me. I mean, it's almost like, okay, you're the ones taking the orders, and now you're the ones giving the orders.
Giving the,
And you're
Mhm.
giving the orders, you're responsible for the order you done
Yep.
gave now. And
Hmm.
then now you have the staff nurses calling you with all the questions when there's a status change of a patient. So that was the biggest, and I think the hardest part for me and new nurses who are transitioning to become a nurse practitioner. And that's why I kind of focus on that transition piece with my nursing mentoring business, because that is hard. It's a new level of responsibility, liability. It's
Hmm.
just a whole new higher level of risk of malpractice.
Exactly. You
So
have to
you
start paying
really,
malpractice.
right, you want to have that extra. It's not just becoming a nurse practitioner. It's all about knowing the risk of everything that you're ordering and doing. There's a risk associated with it, and you have to be aware of that. So I think that was the hardest for me.
Yeah, yeah. How long have you been in the world of nursing? How many years?
So I became a nurse in 2006.
Okay.
So I think that's almost 15 years.
Yeah.
So I became a nurse in 2006. I became a nurse practitioner in 2011. So almost 10 years.
Wow. Yeah. That's so awesome. I think I was graduating high school in 2011. But
Well, you got to start somewhere. That's why I tell people you got to start somewhere. We don't just all just wake up and we just woke up like this. It don't work
yeah.
like
We didn't just wake up. I
no.
love that. I love that. So it's kind of to piggyback off of that, can you describe your experience working as a Black woman in nursing?
Ooh, that's a good one, especially on Juneteenth.
On
Definitely
Juneteenth.
on Juneteenth. Overall, I can say my experience overall has I would say up and down, mostly positive.
Mhm.
As a nurse, a lot of times I would feel like, number one, at that time when I started, people like, oh, are you old enough to be a nurse? Are you the housekeeper? Are you the secretary? Just because of the color of your skin, that does not dictate who or what you can do.
What
Yes,
you
I could be a Black housekeeper. I could be a Black nurse. I could be a Black doctor. I could be a Black nurse practitioner. But it's almost like people just automatically look at you, see the color of your skin, and they want to make all these assumptions about you. But it's so funny how quickly you open your mouth, they see your knowledge level, and they're like, all right, she knows her stuff. And the level of respect just goes through the roof. And
Yeah.
that's what, those are the kind of barriers that I want, African American nurses, nurse practitioners we can go past these boundaries of what people expect of us and just blow them through the water. So it just
Yeah.
because you look at me, you see a certain color, that doesn't mean, okay, I'm only at this standard. I want to bring the bar up here.
Hmm.
So sometimes you just have to, unfortunately, it's almost like you have to prove yourself to patients and
Yeah.
other staff members. And I
Yeah.
experienced that as a nurse and as a nurse practitioner.
Yeah, yeah. That's so, I'm sure there are many people that's watching right now that can relate 100% to everything that you said in terms of, they see the color of your skin and automatically make an assumption. But then when you open your mouth and you're hitting them with all this knowledge, then,
No, all
they
that
have
goes
to,
away.
yep, they have to take a step back. Um, so I am actually currently in my DMP clinicals. And I want to ask you this. This is my own personal question that I kind of snuck in here. We have to do so many ICD-10 coding, like so much coding for Medicare. I think it's to take care of Medicare patients.
Right.
For those of you that don't know, the ICD-10 codes are what we use to put into the computer, so that we can get paid, so that we can get reimbursed for the work that we do. How long did it take you to become familiar with those codes, or did you ever have to learn those codes?
Okay, so in the current role that I have now, I don't do any billing or any coding. Thank God.
Oh, I'm so jealous.
So in the inpatient setting, because I work for a hospital, I don't work for a private group. The hospital takes care of I don't do any billing at all. So there's another plus side to
Uh,
being in the hospital.
that is
Um,
so, yeah, that's good.
but are you doing clinicals in an outpatient setting?
Yeah. Hmm.
So an outpatient, and also for your school, they want you, they teach you. For clinicals, I had to do the ICD 10 codes, and also when I was outpatient, I had to do coding then. So
Hmm.
that takes time. It's almost like I had a booklet of all of the common diagnoses and disease process and procedures. I have a little brain book that I carry around, and all the common ones, I would
Okay.
write them down and just get familiar with those. And it does take time.
Okay. Okay.
But if you
That's
don't,
reassuring to
unfortunately,
hear.
exactly. And unfortunately, if you don't, the problem with ICD-10 codes, if you don't put them in, you don't get paid.
Exactly. I
So
don't
they
want to be
are,
the reason why we don't get paid.
right. So it is important. It's very
Yeah.
important, but it does take time.
Yeah.
So be
Um,
patient.
I appreciate hearing you say that. In terms of the Affordable Care Act, the recent implementation of the Affordable Care Act, did you see did that affect your practice in any way in terms of your work in the hospital or just the patients that you see? Did you see any effect of the Affordable Care Act in your practice?
I think one big thing with the Affordable Care Act when it did take effect, I would say, is the reimbursement, which even though I don't deal with it specifically, for example, like say if we do, I work in cardiothoracic surgery, so I deal with patients who are having bypass surgery, valve surgery. I just know there was a difference in payment towards the surgery itself. Like instead of, okay, every day I write a progress note, we get paid daily. They got one lump sum. So it doesn't matter what kind of documentation I did, they got one lump sum. So
Got
for me,
you.
I mean, my practice didn't really change because I'm going to document, appropriately each day. But that was the big change, I think, for the surgeons themselves, but not specifically for me.
Okay. I was going to ask you if you can kind of describe the role that the DNP will play as in the cardiothoracic surgery world. Like, what are some things that you do? Can you kind of describe that experience to us?
Specifically to DNP or nurse practitioner or combination?
A combination. You can kind of expand on the differences, where a DNP would do this, but a nurse practitioner would do that.
So for me, because I completed my doctorate 3 years ago.
Okay.
So I was already functioning as a nurse practitioner from 2011 prior to that. So as a nurse practitioner, my role basically, I call the nurse practitioner role a facilitator. I feel like I'm always facilitating something.
Right.
So as far as my role in cardiothoracic surgery, I see patients pre-op and I see them as well as post-op. So I'm
Gotcha.
trying to get the information to work them up for their surgeries, make sure everything's in order, labs, diagnostics,
A nice history.
the history, that kind of information. So once they're ready for surgery, pre-op, initiating the pre-op orders. Post-op, I'm the one seeing them on the step-down units, getting them ready. So anything that they need to go home, whether it's home healthcare orders, I'm ordering that, adjusting their medication, titrating their medications or diuretics, that labs are appropriate. They have all of the resources they need in the outpatient, so in that transition process. And that's where I did my DNP project came in, my project was on educating the nursing staff on how to transition patients from the hospital to go home in the outpatient setting. So it was more on transitional care, educating them, knowing what tests they needed inpatient for their procedure to get them home, and educating them so they don't get readmitted back to the hospital. That was my DNP project.
That's awesome. That would definitely help decrease readmission rates. That's awesome. That's so cool to hear. I have a few more questions, and then we can tap into the chat and see if there are any questions there. How do you practice work-life balance? And I asked you this because when we started, you gave us your list of things that you do. I didn't even know that you taught. I didn't know that. That's so awesome. So how do you practice work-life balance?
So for me, the one big thing with work-life balance, it's a hard thing. It's a hard task for anyone. Like, let's be real. Like, we're trying to work. Like, I'm a mom, and also you guys know I'm expecting twins, which will be here in a month.
So crazy. We were gonna get to that.
For me, it's about having a schedule that allows you to have a home life, a work life, your personal life, and there's days that you want to do nothing. You know what I mean? Or if you want to turn up, whatever it is that you want to do. So for me, the problem with the role as a nurse practitioner, I know a lot of jobs, the quote unquote traditional jobs, you work like a Monday through Friday kind of job. So for me, the hardest part transitioning from an RN to an NP also was going from working in a hospital 12 hours to 5 days a week at a hospital. To me, I hate 5 days a week.
I can relate, yes.
I do not like working 5 days. I feel like you're working Monday through Friday, you're tired after that, and then on the weekends, you're like, one day you're trying to clean your house, and then it's like Sunday,
then Sunday and then Monday.
And then it's like right back into Monday, right?
Yep.
So when I took this job, my goal was like, how do I cut down on the days. So we got our boss there, like once we got enough staff, we could go down to 410. So
Okay.
we got the staff, and now we're at 410. So I had
Okay.
3 days off.
Right, right. Okay, extra day.
We have an extra day because you may have a doctor's appointment. You may have
Mhm.
to just run an errand or something. You don't want to have to use your vacation time to do those regular life things.
Yeah,
So for
yeah.
me, I like balancing for me in the hospital is good because when I'm done, I'm done. I don't take calls. So
Okay.
that affects work-life balance.
Mm-hmm.
And I don't take charts home. I don't document home. I do nothing work. When work is done, it's almost like I just kind of either blast my music or I'm driving home in silence to clear my mind.
Yeah,
And then
yeah.
it's family. When I get home, it's family time.
Yeah, yeah, yeah.
What we eating for dinner, talk about the day, that kind of stuff. And then on my days off, if I want to sleep all day, that's what I do.
Yeah, yeah.
If you're gonna have a cleaning day or whatever, that's what I'm doing. And or if I want to hang out with family or friends or go to brunch with my girls or something like that, and just having that balance and put it on a planner if you need to keep yourself that organized. Or I
Mm-hmm.
have alarms on my phone to keep everything, remember things. There's regular things you have to do, like you got to pay bills, but I set everything up on automatic payment because I can't remember.
It's okay.
It's just little things like that that's going to make things easier for your life.
Yeah. No, that's genius. When work is finished, work is finished. You're not taking any calls outside of work.
No,
Yeah.
got
It's
to
the
work.
little
Think
things
about
that
work.
make the biggest differences. Yeah.
Right.
Yeah.
And I know especially for new nurse practitioners, I think when they get home, they're like, oh my God, did I miss something? Oh, did I do this? And did I do that? But at the end, that's you.
And I'm not even finished. I'm not even done with school. Like I'll come home and say, did I put that in the note? Like I'll think about, I try to do my notes. I start while I'm in the room with the patient
Right.
and then, finish up outside the room before going to see the next patient. But sometimes you just have so many patients. And by the time you finish writing the note, or like right before you're about to finish writing the note, the next patient comes and then but I have taken a page out of your book in terms of making sure that what I do is if I have to stay that extra 30 minutes or whatever the case may be, finish up all my notes. And I know that once I leave the threshold of that door,
Right. Work is
work is
done.
here.
You have to work is done because you have to
Mhm.
go on with your life. I mean, you may have, significant other, you may have a dog or whoever you got at home that you got to pay attention to,
That
so
exactly.
you almost you have to turn work off because you have to take care of you. You may just want to go get a massage or just relax. You have to have that self-care and that balance in there.
Massage. That sounds
Yes.
good.
Yeah. We all need one.
We all need one. Somebody put in the chat, it says, what is the most challenging thing about being an NP/DNP?
The most challenging, I would just say the level of responsibility that you're taking on transitioning from a nurse. Because remember, when you're a nurse, you're taking orders from someone else.
Hmm.
Something that you don't have orders for something, you got to call a provider. It's the
Yeah.
provider's responsibility to take care of it. Now you're that provider and you're responsible for addressing it and knowing the evidence and the right thing to do for that patient.
I
So I
want
guess
to
the
piggyback.
level of responsibility.
Yeah, I want to piggyback off of your answer actually. And um, were you a floor nurse prior to becoming an NP?
Yes.
Okay, so having that experience when you were while you were in school to become an NP, were there times where you felt kind of glad that you had that experience as a floor nurse, where you would see certain situations and say, this is familiar. I know that this is what the normal or the usual plan of care would be. Thank goodness I have that experience because now I can move forward confidently. Or were you still hesitant being in that provider role? Were you still hesitant to move forward? Although that you knew the information, were you still kind of cautious to move forward?
Yes to both answers. I was cautious because you're like, okay, yes, I know that's what the evidence says to do, but does it match this patient as well? So you were always
Mhm.
second guessing yourself as a brand new NP. And that's normal. That is a normal feeling, and you're going to feel like that for a while. So expect that, number one. And me being a floor nurse before becoming a nurse practitioner, I think in the back of my head, even though I am functioning in a nurse practitioner role, I'm sitting in my head, I'm a floor nurse still, because I'm like, okay, I was there as that nurse.
I feel like I can't get out of it.
Yes.
Yeah.
In my head, I'm like, okay, I know this nurse got a lot going on right now. How am I going to make this the easiest way for her? I'm going to make the orders simple.
Yeah.
There's no confusion. I'm going to run with her. We're going to talk, answer all her questions. I'm that provider that's like going the extra mile because I'm like, I was there.
I was there. Yes. Yes. Yes.
So
I feel like that's something you can't, it can only be an advantage, in my opinion, you know. But I think I have some more questions for you. Let's see, you kind of already answered a few of them already. So I'll ask one more of my questions, and then someone had a question here in the chat. The one question I have for you is, what was one thing that surprised you the most during your journey to becoming a DMP?
It's not the nurse practitioner part of it, I think was fine. But I love clinicals. It was the doctorate part, I think, that probably stressed me out the most. It's almost like, okay, just having someone always critiquing your writing, and I think I'm a good writer, but I'm like, maybe I'm not a good writer. I think that part was a little probably more stressful for me than anything, because it's like, all right, I'm already practicing as a nurse practitioner. I'm just getting this doctoral portion of it and implementing my project in the hospital. And I'm just like, should I have done this? Did I waste my time? But I'm like, but at the end, it was all worth it. And all the critiquing, it just made me a stronger person. I would say that.
That's so awesome. I love to hear that. My own project is coming just around the corner. So
So you're gonna be there real soon.
Yes, before I know it. Someone in the chat asked, what made you decide to start Level Up Nursing, and was it hard? That's a good question.
So I actually started Level Up Nursing, I want to say it was maybe 2018. So that was when I was already working in the hospital, but I was going back. I went back to school to get my acute care nurse practitioner certification while working full time. And I was just like, I'm working full time. I'm stressed out. I'm tired. I know other people going through the same issues. And I was like, I started my page as a motivational page, and I did a lot of quotes. And I was like, if I can get through this, other people can get through this too. So we started there. And it wasn't until 2019 to 2020 when I started doing the mentoring and the one-on-one coaching. Because I was like, I have a lot of experience. People are always asking me questions. I mean, sometimes I'm like, do I know this stuff? Do I not? But then it's like, I have like 50 years of experience. And people 10 years. There's so many things that I know that people ask me all the time that I would just post on my page. And it just kind of took off from there. So that's where it kind of started off, with my own journey going back to school.
Wow, that is really awesome and inspirational. I mean, that's kind of right full circle what we're trying to do here with the Village Doctors. I mean, for students, right, who are in varying fields of medicine, just trying to put information out there to help other people the way that we've helped each other, and the way that we've been helped, along our journey. So I think we have this will be the last question. Okay, and this kind of goes with what I asked you initially. It says, what advice would you give Black women specifically in regards to working in the healthcare field?
I mean, I would kind of piggyback onto what I said earlier. Just always be on your A game almost. It's almost like, know your stuff, and unfortunately we do have to prove ourselves. We don't want to be this stereotypical, we don't have to be the angry Black woman. We can be that smart Black girl that knows her stuff, and we can be ourselves, and you can be proud of who you are, and just show your knowledge. Once you show people what you know, they're like, dang, like I wasn't expecting that. You know,
Right.
you gotta shock them a little bit. They're gonna
Yeah.
be shook when they're done with you, girl.
Yeah. Shook it. Okay.
No,
Yes,
seriously. I mean,
doctor.
when you are on top of your A game, there's nothing that they can say. No matter what color, you can be purple, green. I don't care what you look like. They're like, okay, well, she said that. She knew what she's talking about. You know what I'm saying?
Yeah.
Or just listening to your advice and you're able to answer their questions. And they can see, like, okay, she really knows her stuff. She's so professional. Then they're just
Mhm.
like, they're kind of stunned.
Yeah. Yeah. Yeah.
Unfortunately, we really, in a way, have to prove yourselves. But once you do, you have such a higher level of respect from patients and your colleagues.
Mhm. Mhm. We have another question here, so I'm gonna go ahead and ask you because I don't want to leave you without getting these gems. Okay, it says since there are so many NP schools, what are good criteria for picking the right one?
Okay, that's a very good question, actually.
Mhm.
So, number one, I always tell people to pick a school that is within your learning style, because some people, there's a lot of online schools only.
Mhm.
If you're not an online learner, you may need to go to school where you're physically in person,
Mhm.
because then that's not going to work for you. So knowing your learning style. Is it a private? Is it a public school? So cost is a factor, because
Mhm.
we all these schools, some of them are private. They're charging you double the price. Can you afford that? And can you
Mhm.
afford getting that much, like student loans, or apply if you can't apply for scholarships or grants? So cost, is the school accredited? Number one. And how long has it been accredited? Because these schools, I'm telling you, there's a lot of online NP schools, I call them pop-up schools, where they haven't been open maybe a year or two. Then they close, they change the names because their students aren't passing boards because of the low pass rate. So look how long your school has been open. They should be open for more than 5 years if you can find one. And what is the pass rate of those NP programs?
Mhm.
So if you have a school that their pass rate's 98% versus 60%,
Mhm.
that's telling you something right there.
That's a huge difference. Yes.
It's a big difference.
Yeah.
And do I want a 60% chance of passing or a
Or
98% chance of
90% chance of
passing?
right. Exactly.
Right? Oh,
Yeah.
also, and talk to people who went to those schools, because if people are going to talk. In nursing school, people talk. And people, if they have good things to say, they're going to tell you. If it's bad things, they're going to tell you. So talk to people who have went to these schools. Look at their website. The school itself is going to tell you how well they're doing. If they don't have any feedback from prior students of about the program, are they hiding something? If they don't have their credentialing information on the website, that's a red flag. And if they don't have their pass rate on their website, that's a red flag, because it's not
Mm-hmm.
good. Or if it was good, they'd be posting it.
Mm-hmm. Front and
you
center.
know. And the other thing about NP schools, do they find your preceptor for you?
Preach. Say that one more time, doctor. One more
Does
time
that
for the people
N
in the back.
does that NP school find the
Yes.
preceptors for you? As much as you're paying for NP school, you should not be looking for your own preceptors. I'm sorry, not sorry.
Period. Period.
Because that's a
That was
lot. That's a
yeah.
lot of work.
Yeah. 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 I'm so glad you added that. I didn't even think about that until gratefully the school that I'm going to now, they do find your
Okay,
preceptors for
good,
you. And
awesome.
I didn't think to look for it until during the search process. So, whew, thank God for that.
Yeah, because and another thing too, because I just precepted, like, in the past semester. I think I had like 3 NP students that I had rotate with me, but one girl that I precepted, it was an acute care NP program. She had to
Mhm.
find her own preceptors, and they for acute care, it's very important to have a skills lab, and they do not provide them a skills lab. So I'm like, acute care, they're learning how to intubate, do central lines, arterial lines. If you
Yep.
don't have a lab that teaches you how to do that, how do you learn?
How are you gonna get those hours?
So
Yeah.
I that was mind-boggling to me, knowing that I had went back and did an acute care program, and we had a full-on lab for a whole semester,
Hmm.
and they don't have that. So I was like, so if I'm precepting you and you're telling me you know how to intubate someone and you've never done it or practiced, as a preceptor, I would be hesitant to let you do that
Yeah,
in clinical
yeah,
with me
nervous. Yeah.
under my license.
Mm-hmm. Yeah, yeah. No, that's a good
Yeah,
point.
there's some scary things like that.
Yeah, yeah. No, that's a good point. Like I said, I'm glad you brought that up because that is often something that you don't think about until the time comes for you to
Right.
find those clinical sites. And you're like, oh, wait a minute. And then there's so many requirements and things like that. But yes, thank you for that. I want to say thank you for your time. Thank you for agreeing to this interview. Um, my prayers to you and your family for these twins that are coming. Are you
Thank.
nervous?
I'm nervous. I am.
Oh,
I'm excited
don't be
but nervous at
nervous.
the same time.
Don't be, you're a nurse, you'll be fine.
I hope so.
No, that is so awesome. Are you gonna have more twins after this?
Oh,
No.
that's it. End of story. Shop closed. No, ma'am.
I heard that's the last thing that moms want to hear while they're pregnant or after they just given birth
Uh-huh.
is, are you gonna have more kids?
No. We have an older daughter, and we're gonna have a twin boy and girl, and that's it. We're done.
Well, if you change your mind, no, I'm just kidding.
No, there is no changing my mind. No, I mean,
Thank you
I
so
know they're
much.
gonna be like a blessing, but just
Yeah.
wait.
Thank you so much for your time. It is greatly appreciated. Thank you for the gems that you've dropped. Thank you for answering all of our questions. For everyone that's tuned in, stay tuned to the page. Tell your friends and your family to go and follow the Village Doctors. We have amazing things coming. Some things in the wrap. We have right now, we have Trivia Tuesdays. We have Free Game Fridays where we give just encouraging quotes. Workout Wednesdays, make occasional pop-ups with one of our village doctors. She does her workouts. I haven't jumped on that train yet, but I'm coming. I'm coming for the Workout Wednesday. We have a lot of things in the works for everyone, so stay tuned. I want to thank you again so much for your time. I appreciate you.
Thank you so much for having me. You guys had awesome questions, and definitely follow the Village Doctors, follow Level Up Nursing. And if you guys are interested in any mentoring or nursing coaching calls, hit up my page. Link is in my bio. All the information's there. And be on the lookout for the twins because y'all gonna be flooded with these baby pictures.
Let her with the baby pictures. We'll put all the information down below in the comments. Okay.
All right, perfect. Thank you so much. It was a pleasure talking to you. And happy
It was a
Juneteenth,
pleasure.
y'all.
Happy Juneteenth, everybody. Thank you.
All right, bye.